So, so today we will be discussing the emergency medicine and first aid kit. I am Darlene Aquino together with Iris Joy Castillo, Saturnino Paras, Shami Teresa Sasum, and Angel Rose Redonges. Next slide. So let's talk about the basic technical know-hows. Next slide. So first is the parameters to evaluate during the triage. Next slide. Ay, pabalik na muna. So, when we say triage, it is a process of this sorting patients based on the severity of the injuries or illnesses and to be able to determine the priority of treatment. So, why it is important to know the parameters to evaluate during the triage because it helps us the veterinarians to identify or determine urgent care that is required for the patient. Next slide. So first is the mucous membrane. So uh how do we determine or how do we evaluate? So pink is the normal PCV or there's an adequate perfusion or the flow of the blood into the blood vessel. Pale or white, anemia or shock. Cyanotic, severe hypoxia. Yellow, there's an increased serum bilirubin due to hepatic disease or hemolysis. The easiest mucous membrane to be evaluated are inside our pet's mouth. Sometimes there's a color discoloration, so may iba't ibang color ng gums, meron yung iba may black. So, pwede rin siyang i-check sa inner cheeks. The mucous membrane color reflects the oxygenation and perfusion of the tissue. Next slide. Next is capillary refill time. So 1 to 2 seconds. Normal perfusion and rapidity with which capillaries refill with blood. Greater than 2 seconds for perfusion or peripheral vasoconstriction. Less than 1 second, there's a hyperdynamic state. It could be associated with fever, heat stroke, distributive shock, or early compensatory stage of hypervolemic shock. So how do we assess CRT blood flow? In checking CRT, the veterinarian will press, then release the pet's gum with their finger. So there are so many capillary in animal gums, and when it's pressed, blood is forced out of the capillary, and when pressure is released, the blood will immediately fill the capillary. Next slide. Next is heart rate. 70 to 120 beats per minute in small dogs, 60 to 120 beats per minute in large dogs, 120 to 200 beats per minute in cats are the normal heart rates. It indicates that at least one component of cardiac output is normal. Bradycardia, decreased cardiac output and subsequent poor perfusion. Cats, in particular, mostly develop bradycardia, less than 120 beats per minute when in shock. An irregular slow heartbeat can be associated with imminent cardiac arrest, severe arrhythmias, or metabolic der- derege- deregiments, deregiments, or hyperkalemia and hypocalcemia. Next. Next is tachycardia. In dogs, greater than 180 beats per minute. In cats, greater than 220 beats per minute. Comprise diastolic feeling. The sinus tachycardia often results from hypervolemic shock or pain. Tachycardia that is irregular or associated with pulse deficits usually indicates an arrhythmia and an ECG is indicated. Next slide. Next is the pulse rate and the quality. So, when evaluating, strong and synchronous with each heartbeat means normal, and both femoral and digital pulses should be palpate. Next, irregular. It's usually an indicative of a cardiac arrhythmia. Bounding, hyperdynamic or compensatory. There's a compensatory state of shock. Weak or absent, there's a decrease in cardiac output, peripheral vasoconstriction, decreased pulse pressure, and thrombosis. Next. Level of consciousness. Evaluation, alert and responsive to the surroundings, the normal overall neurologic and metabolic state. So if it's depressed or uptunded or hindi siya medyo alert, can be caused by any illness or decreased perfusion and may be mild, moderate, or it can be severe. Stupor, arousable only with painful stimuli. There's severe neurologic and metabolic derangements. Next slide. Next is comatose. Unarousable with any stimuli na siya. Seizures usually associated with whole body convulsions, salivatory, facial tremors, and there's a possibly involuntary urination and defecation. Abnormal cerebral electrical activity from primary neurologic disease or secondary to metabolic derangement seen in diseases such as diabetes, hepatic encephalopathy, hypoglycemia, and toxin exposure. Accurate history or prior heart problems, current medication, and possible toxin exposure is important. Next slide. So level of pain. Presence of vocalization, there's changes in behavior, either avoidance or aggression, or there's a physical changes. Clinical signs can be similar to those seen in compensatory state of shock. Pain delays healing and it must be treated right away. Next slide.
Number two is shock. It is a medical term for changes that develop when the body attempts to compensate for limited heart function, blood volume, or circulation. It is a life-threatening condition. It happens when the body isn't getting enough oxygen to the vital organs. So there are five main types of shocks, namely the cardiogenic shock due to the heart problems. Number two is hypovolemic shock caused by too little blood volume. Number three is anaphylactic shock caused by allergic reaction. Number four is septic shock due to infection and neurologic shock, which is caused by damage to the nervous system. So these are the examples which causes shock. Number one is the blood loss, trauma, and excessive fluid loss ay pumapasok yung hypovolemic shock, which makes the heart unable to pump enough blood to the body kasi sobrang dami na yung nawalang dugo at mga fluid sa katawan. The allergic reaction is an example of anaphylactic shock. Heart failure is an example of cardiogenic shock that happens when your heart cannot pump enough blood and oxygen to the brain and other vital organs. The airway obstruction is an obstructive shock arises from blockage of the circulation. Pneumonia and severe infection is an example of septic shock. And the nervous system damage is neurogenic shock. For the early stages or stage 1, it is also called compensated or non-progressive. The signs are bright red gums, rapid pulse, anxiousness, shallow breathing, and palpable pulse. For the stage 2 or middle stages, it is also called decompensated or progressive. The clinical signs are increased heart rate, decreased rectal temperature, cyanotic gums, lips and eyelid, non-readily palpable pulse, weakness and lethargy, increased shallow breath rate, or may remain normal. The systems of the body are unable to improve perfusion any longer, and the patient's symptoms reflect that fact. Heart rate, breathing rate are still above normal, and blood pressure may be close to normal or below normal. The last stage, or the stage 3, is also called irreversible. The clinical signs are critically low rectal temperature, white or mottled gums, muscle failure, increased or irregular heart rate but may also remain normal, non-palpable very weak pulse, glaze, unfocused and dilated pupils, low and shallow or rapid and deep breathing, and stupor or coma. The cells in organs and tissues throughout the body are injured and dying. The endpoint of stage 3 shock is patient death. Next is cardiopulmonary resuscitation, or CPR. It is a first aid technique that can be used to help save an individual's life if their breathing or heart stop. It can help to save a life during cardiac arrest. When the heart stops beating or beats to ineffectively circulate blood to brain and other vital organs. This is the basic cardiac life. Number 1 is remove obstruction and 2 breaths per pad compressions. For animals who are greater than 14 kilograms, you need to compress 100 compression per minute, and greater than 14 kilograms, you need 80 compression per minute. Continue until patient has stabilized breathing. You need to lay the dog on a flat surface with his or her right side against the surface. Cup your palms and hold the dog with one palm on either side above the heart region. If only one person is available, if there is two, give breaths every 2 or 3 compression. The chest must rise enough. So these are the drugs used in CPR and defibrillation. Number 1 is epinephrine. The dosage are low dose 0.01 milligram per kilogram. Low dose 0.01 milligram per kilogram every 3 to 5 minutes per early in CPR. High dose 0.1 milligram per kilogram after prolonged CPR. 10 times the dose may be required when given intrathecally. And then for the indications, asystole, ventricular fibrillation, and pulseless electrical activity or PEA. Number 2 is atropine, 0.1 milligram per 5 pounds, 0.5 milligram to milliliter solution. Indications are sinus bradycardia, asystole, PEA associated with high vagal tone. Number 3 is sodium bicarbonate. The dosage is 1 MEq per kilogram. Indications are severe metabolic acidemia associated with prolonged greater than 10 to 15 minutes cardiopulmonary resuscitation efforts must be adequately ventilated to be effective. Hyperkalemia. Number 4 is vasopressin, 0.4 to 0.9. Indications are combined with or as a substitute for epinephrine every 3 to 5 minutes, asystole, bradycardia, and PEA. Lidocaine, 2 to 4 milligram per kilogram, pulseless ventricular tachycardia, ventricular fibrillation resistant to defibrillation. Last is defibrillation, 4 to 6 joules per kilogram external monoplastic, 4 to 2 to 4 joules per kilogram external biphasic, 0.2 to 1 joules per kilogram internal. Indications are single shock, resume CPR efforts immediately after 1 cycle, 2 minutes. Dose escalation may occur. So the epinephrine is the most commonly used drug in CPR for dogs and cats. Epinephrine is a non-selective adrenergic agonist. It is the most commonly used vasopressor for CPR therapy.
Next is fluid therapy. A basic objective is to restore the volume and composition of the body fluids to normal with respect to water electrolytes. Next po. Types of fluid. Free water fluid, substance that gives free water, 5% dextrose solution, yung example niya. Second is crystalloids, containing electrolytes and non-electrolyte solute that are capable of entering all bodily fluids compartment. Example niya is 0.9 saline and lactated ginger solution. Next is colloids, solution of large molecular weight that are restricted to plasma compartments of the blood. Plasma dextran and hydroxyethyl starch solution. Next is potential acid-base disturbance in some emergency cases. case is vomiting, type of hydration, isotonic or hypertonic, electrolyte balance, sodium, potassium, and chlorine loss. Then acid-base status, metabolic alkaloid, metabolic acidosis, chronically, fluid therapy, Ranger solution with 0.9 saline with potassium chloride supplementation. Next is diarrhea, isotonic or hypertonic type of dehydration. Then electrolyte balance, sodium and potassium loss chronically. Metabolic acidosis, balance. Then fluid therapy, balance electrolytes with balance electrolyte solution with or potassium chloride. Next is hemorrhage shock, isotonic. Then metabolic acidosis siya. Tapos yung ano is balance electrolyte solution, blood. Next po. Next is yung endotoxic shock, type of dehydration, isotonic, acid-base status, metabolic acidosis, fluid therapy niya, balance electrolyte solution with or 0.9 saline. As next is congestive heart failure, plethoric, sodium water retention in early stages, and then hypotonic chronically. Electrolyte balance, sodium retention but delusional hyponatremia. Acid-base status niya is metabolic acidosis chronically. Then yung fluid therapy niya is 5% dextrose solution. Next po. Next is muzzling. Yung process ng pag-muzzle is a temporary muzzle can be created from a strip of cloth, find a cloth bandage or rope or long strip of fabric, tie the knot in the center of the bandage, make another loose knot several inches above the first knot, slip the loop over the dog muzzle, and gently pull the knot tight. Then step 1, cross the end of the bandage under the dog's jaw and firmly tie. Step 2, firmly tie the cross end behind the dog's neck. Then, yung ganitong type of muzzling is hindi dapat ginagawa sa unconscious and unresponsive animal dahil kapag ka ganun is mas mahirapan silang huminga. Kaya dapat sa mga conscious animals lang ginagawa yung ganun. Next. Emergency cases. Next po. So poisoning. Poisoning occur when a toxic substance swallowed, inhaled, or absorbed after coming in contact with the skin, eye, or mucous membranes. Next po. Poisoning induced vomiting. Ginagamit is hydrogen peroxide. 5% 5 ml per 2 kilogram and maximum of 45 to 60 ml. Repeat if the animal has not vomited after 15 minutes. Next is activated charcoal, 1 tab in 10 ml of water. Then yung bibigay mo is 5 ml per kilogram. Next po. Next, ingestion of arsenic in rat and mouse poisoning, chocolate or pesticide, lead, matches, medication except tranquilizer, plant shampoo, and shoe polish. Next po. Then, yung signs niya is lethargic, unconscious, unconscious, convulsing, having a seizure, or in shock. Ingested acid or alkaline products. Ingested acidic or alkaline products is yung mga drain cleaner, household cleaner, and paint cleaner. Ingested tranquilizer, bone sharp objects, or petroleum products such as gasoline or lighter fluids. Next. Para ma-neutralize yung mga ganun is hugasan yung bibig, then milk of magnesia. And yung bibigay sa dog is 30 ml per kilogram, tapos sa cat naman 5 ml per 2 kilogram. Yes, next po. Sa mga acidic yung binibigay yung milk of magnesia. Next po. Kapag alkaline poisoning naman, yung procedure dun is rinse the mouth, then bigyan ng vinegar, 5 ml of vinegar with 15 ml of vinegar, and na ihahalo sa 15 ml na water. Then pwede rin yung lemon juice, 15 ml ng lemon juice with 1 tablespoon of sugar. Next.
Next case is trauma. A tissue injury that occurs more or less suddenly due to violence or accident and accountable for initiating hypothalamic pituitary adrenal axis, immunologic and metabolic response that are responsible for restoring homeostasis. For next four. Next slide, please. For the initial management, when an animal undergo to the trauma, we have to stabilize the patients, we have to stabilize the animals, and then examination of orthopedic or neurological examinations, and we have to give the fluids and oxygen therapy. For the fluid and oxygen, shock dosage like Normasol or LRS. It's a 60 to 90 ml per kilogram per hour for dogs and 40 to 60 ml per kilogram per hour for cats. And for analgesic, there is a non-steroidal anti-inflammatory drugs. Meloxicam 0.2 ml per mg per kg. Carprofen 4 mg per kg. And then we have opioids, methanodon 0.2 mg per kg, bupropion 0.02 mg per kg. And the next one is blunt trauma, also known as non-penetrating trauma or blunt force trauma. Refers to the injury of the body by forceful impact or fall from high places, physical attack with a dull objects. Next, please. Next is thoracic and abdominal trauma management. No improvements after initial management. That means a tracheal intubations and positive pressure ventilations with 100% oxygen. And for the breathing with an asynchronized movements of the chest and dull and quite lung sounds. That is thoracocentesis, abdominocentesis performed before radiographs, and ongoing leakage or any bleeding of an air after 72 hours of a pleural drainage means that chest or abdominal exploratory laparotomy, commonly associated with thorax and abdominal bleeding like organ rupture, fracture, or neurological injuries. Next slide. Next is there is a criteria for abdominal exploratory laparotomy in trauma. First, we have to check ongoing hemorrhage. If there is any bleeding or anything, we have to criteria for that. Inability to stabilize shock, organ rotation, endarterectomy or diaphragmatic hernia, evidence of organ rupture or peritonitis. Next slide. Next is penetrating trauma, an injury caused by the foreign object piercing the skin, which damages the underlying tissue and results in an open wound. The most common cause of such traumas are gunshot or explosive device or stab wounds. Back, the previous slide. Yeah. Open fracture management. For this open fracture management, we have to prepare not to contaminated wounds. We have to be careful. For the preparation, we have for clipping, area disinfection, cleaning, and debridement. In debridement, we have a mechanical and enzymatic. And then last is protection, and we have to contact layer, intermediate layers or out bandage layers. Next, like what we discussed earlier. Next, ordinary wounds of trauma. Sanitize hands, clip fur around the wound, clean out debris and irrigate wound using saline solution or deadline. Apply antibiotic ointment. Do not use hydrogen peroxide or alcohol in cleaning the open wounds. Wrap in a clean bandage. Next case is burns. It may be a chemical or heat or electrical. An injury to the skin or other organic tissues, primarily caused by heat or due to the radiation or radioactivities or electricity or friction or contact with the chemicals which will burn the skin. Next is for the clinical signs of heat burns. Sign for blistering, swelling, redness. And for the initial management of if the animals has heat burns or burns, flesh burns immediately with lot of cool or running water. We have to clean that. Apply an ice pack for 15 to 20 minutes to stabilize the animal. Do not place any ice pack directly onto the skin. Instead, we have to wrap the ice pack in towel or any cloth, lightweight cloth. Next, please. Next is chemical burns. Neutralization like acid burns. It may be a baking soda and H2O. Alkaline burns may be vinegar, weak vinegar H2O solutions. For the management of a chemical burns, blood dried, apply antibiotic ointments or olive oil and tap tape gauze loosely around an affected area. Brush off dry chemicals on skin. Do not rinse with water. For large burns, wrap it in wet towel. Not we don't need to use the ice pack. Next, electrocution signs is panting, breathing difficulty, burn across the lips and tongues, unconsciousness. For the management of this one is rinse mouth with cold water if animal is unconscious. Perform recu breathing, CPR if pleasant breathing is absent, pulsant breathing is absent. Wrap animal in a blanket to prevent shock. Next,
Choking signs: foaming at the mouth, gagging, gasping, breathing difficulty, odd neck posture, abnormal gum color like blue, gray, white, unconsciousness. Management: check for obstruction, remove obstruction. If you can clear the airway or the animal is struggling, hold the pet upside down, raise back legs if you can, or use a Heimlich type maneuver and push up with your fist held under the animal's belly just behind the rib cage. Next slide. Drowning. If your dog falls into a body of water or is submerged underwater for any length of time, seek emergency veterinary care immediately. Perform CPR. If still in distress, hold by the hind legs and gently swing back and forth to clear water from the lungs and stomach. For large pets, place on its sides and press upward on its midsection or abdomen. If necessary, perform Heimlich maneuver. Next slide. Heat stroke. Dogs suffering from heat stroke can have excessive panting, labored breathing, bright red mucous membranes, lethargy or weakness, up body temperature, collapse, seizures, and even coma. Management: place cool, wet towel over the patient, submerge in cool or lukewarm water, apply rubbing alcohol, provide drinking water. Do not apply ice directly to the skin as it may cause skin damage. Next slide. Next slide. Seizures. Management: put light pressures patient's eyeballs for a minute. Clear area around the patient to avoid injury. Document the event and what led up to the event in seizures diary. Give medications such as rectal diazepam. Next slide. Eclampsia. A sudden onset of potentially life-threatening symptoms resulting from low blood calcium hypocalcemia in the female dog, bitch, or female cat, queen, that has given birth in the preceding 3 weeks. Next slide. Eclampsia signs: panting, pacing, restlessness, muscle stiffness and trembling, inability to rise, seizures and coma. The treatment: calcium gluconate, slow IV, dextrose, anticonvulsant. Next slide. Part 1. Gastric dilation. Stomach fills with air, pressures to the diaphragm, compression of the large veins in the abdomen. Stomach rotates, blood supply pitch up, necrosis sets in. Next slide. Next, no. Sa may picture. Sa may picture. Back. At ang gastric or a computer tomography scan the abdomen. Next. Next slide, please. Clinical signs management. Abdominal distension, non-product vomiting, retching, restlessness, abdominal pain, rapid shallow breathing, profuse elevation. Management, antibiotics and analgesics, fluids, removal of gastric air, radiograph, gastropexy. Next slide. Vaccination. It offers an effective and expensive way to prevent a deadly disease from harming the animals in their care. These medicines are foundational to any animal health program, with the benefits extending even to public health. Next. Dog age 6 to 8 weeks, the recommended vaccinations are distemper, measles, parainfluenza, and optional Bordetella. From 10 to 12 weeks, the recommended vaccinations are DHPP, and optional coronavirus, leptospirosis, Bordetella, Lyme disease. From 12 to 24 weeks, recommended vaccinations, rabies. From 14 to 16 weeks, the HPP and optionals are coronavirus, Lyme disease, leptospirosis. From 12 to 16 months, recommended vaccinations are rabies and the HPP, optional coronavirus, leptospirosis, Bordetella, Lyme disease. Every 1 to 2 years, recommended vaccinations, the HPP, optional coronavirus, leptospirosis, Bordetella, Lyme disease. Every 1 to 3 years, recommended vaccination, rabies as required by law. Next slide, please. Feline vaccination schedule.
Kahit wag mo na pong basahin natin.
Okay, next slide. Next. Thank you. That's all.